I want to thank everybody for coming to hear about DOI's report of our investigation into significant breakdowns by Corizon Health Inc., which is the private company that provides healthcare services at Rikers Island, as well as the fairly concerning lack of oversight by both the Department of Corrections and the Department of Health of Corizon. Before I begin, I want to thank some people. I'd like to thank my first deputy, Leslie Brobner, Deputy Commissioner-in-Chief of Investigations, Mike Carroll, and Senior Inspector General Jen Skulko, who deftly supervised the many moving parts in a fairly complex investigation. Jen is seated up here with me. I also want to thank First Deputy Inspector Chin Ho Cheng and Assistant Inspector General Kate Strojeski, who worked day and night on this case for the last 6 months and did really, really remarkable work. And I want to take a second to thank them all publicly. This is the third report by the Department of Investigations on our broad and wide-ranging and ongoing investigation into serious problems and illegal behavior and failures within the city's jails. Already, our investigation has led to arrests and reports related to contraband smuggling, assaults of inmates and subsequent false reports, deficient recruitment and vetting of correction officers, and flawed screening of correction staff as they enter the facilities that has on several occasions facilitated a thriving smuggling trade at Rikers. Today's findings deal with deficient hiring by Corizon and the improper supervision of Corizon by both DOC and DOH-NH. DOI began this investigation last September after we arrested a Corizon employee who was arrested for taking bribes for smuggling contraband, including tobacco and alcohol, into inmates. Other arrests of Corizon employees followed, most recently last month when we arrested a Corizon employee for trying to smuggle a straight razor into the facility. Now, the good news here, there is actually some good news here, is that the enhanced screening procedures that were put in place at Rikers following our report on smuggling caught this Corizon employee, caught the razor blade, and we were able to keep a weapon out of Rikers. That's the good news. The bad news is that after we arrested this employee and took him and booked him and fingerprinted him, we discovered that this employee had multiple prior felony convictions and had served 13 years for kidnapping. Facts that had entirely eluded Corizon and the Department of Corrections and the Department of Health. But our investigation here went beyond individual arrests to look at the systemic problems that are involved and were involved with the failures by Corizon. The systemic investigation, in addition to multiple arrests, involved, we conducted surveillance, we reviewed thousands of pages of documents, and we visited 28 of 30 housing areas that focused on inmates with in need of mental health treatment. What we found was that in a review of 137 mental health clinicians and 48 mental health treatment aides, we determined that Corizon failed to adequately background employees, resulting in 8 mental health staff with prior criminal convictions, including second-degree murder and drug possession, to say nothing of the kidnapper who had spent 13 years in jail for kidnapping. DOC, as I'll discuss in a few minutes, DOC had failed to do proper background and fingerprint checks on these people, and Corizon never followed up to make sure that those backgrounds were done. Even when Corizon knew about the criminal history of some of its employees or potential employees, it hired them anyway. And we also found no evidence that Corizon conducted any kind of background investigation into the employees they were sending into a secure prison facility in 85 out of 185 files. even after hiring, Corizon's failures continued. Only 8 of the 134 Corizon staff who worked there, whose files we reviewed, who worked there for more than a year, ever even got an annual evaluation from Corizon. In addition to the failure to do screening and background checks, there was a failure to provide appropriate mental health and health services. For example, we found several instances where inmates were improperly removed from court-ordered suicide watch. We found instances where inmates with serious mental illnesses were not properly supervised. And we found a failure to take even the most basic precautions in the dispensing of medicine, including psychiatric medicine, to inmates at Rikers, including failing to take basic checks to make sure that when inmates were given medication, including psychiatric medication, that they actually swallowed the pills they were given. Finally, in a review of phone calls, we reviewed phone calls made to and from inmates and Corizon employees, and we found that 10%, roughly 10% of the Corizon employees that we were able to track, 16 out of 185, actually were receiving calls from inmates after they were hired to begin working at Rikers. In addition to Corizon, DOI also found significant failures by both the Department of Correction and the Department of Health to supervise Corizon's provision of services. And while Corizon, DOC, and DOHMH share responsibility for the administration of healthcare services, what we found is that those two entities did not effectively communicate, that they routinely insisted that a different entity was responsible for basic precautions. And as a result, the failure to communicate was a major roadblock to fixing any of these problems. By way of example, this is sort of an alarming one. At the outset of the investigation, we were informed by DOC staff, senior DOC staff, that DOC had no way to do background checks of any of the employees hired by Corizon. However, it turns out, when we checked both the contracts and the various other legal requirements, that DOC not only had the ability, but the obligation to be doing fingerprint checks of all Corizon employees. The result is that it turns out that a DOC deputy commissioner allowed 658 fingerprint cards to just pile up in envelopes in a desk outside his office without ever sending them to be fingerprinted. And the only way that we discovered this, and in copies of the report that you have, you'll see a picture of it, is that when we went and conducted a search for the missing fingerprint cards, we were told, oh, we don't know anything about them, and then we discovered that all the missing fingerprint cards had been piled up on a desk outside or a shelf outside the Deputy Commissioner's office. Similarly, the Department of Health failed to properly supervise Corizon. As I mentioned, Corizon actually only did their own evaluations of 8 out of 135 employees. DOHMH failed to ever oversee that process or to intervene to make sure that that supervision was properly provided. Let me sort of conclude by making this observation. We've issued a report. We've obviously arrested a number of people in connection with this. We've issued a report with a number of recommendations for the city on what it needs to do if we are going to provide safe and basically effective mental health services and appropriate hiring of staff. But this investigation is not complete. DOI's investigation is very much still in progress, and the Department of Investigations will continue to monitor all aspects of the legal activity at Rikers Island. That monitoring will make full use of DOI's unique access to city documents, to the city's jails, to covert surveillance, informants, and undercover officers. And I fully expect that there will be additional arrests and additional detailed recommendations in the coming